Good morning. My name is Dominique Paje. I am an incoming junior at the University of Missouri, Kansas City. I study chemistry and biology, and I'm originally from Joplin, Missouri.
Good morning. My name is Antonio Zamudio Moore. I attend Rockhurst University, studying nonprofit leadership and history. I'm a rising junior and a local here in Kansas City.
Good morning. My name is Alexandria Stanton. I'm a rising junior studying biology pre-med at North Carolina A&T, and I'm originally from Memphis, Tennessee.
And we are here today to suggest policy implementation that could increase trust between a patient and a healthcare system, as well as hold our hospitals more accountable. For the past 2 weeks, we as a cohort has had the privilege to listen to some of our country's most prominent leaders in healthcare today. And whether they run a nonprofit or a for-profit, they agree that running a hospital is analogous to running a business. Mr. Razan, if you go to a restaurant and you're unsatisfied with your meal, the staff was rude to you, do you believe you're entitled to a refund?
Yes.
That said, that said, if running a hospital is analogous to running a business, shouldn't patients receive their money back if they were unsatisfied with their patient care experience as it relates to customer service? Furthermore, how can a healthcare system that commits itself to the compassionate care of patients and families not return the money to those who felt they did not receive the care they were entitled to receive? And that is the essence of our presentation today. We'll be focusing on 3 main points. What is a money-back guarantee? An example of a healthcare system that already implements these programs, and our policy proposal. What is a money-back guarantee? The goal of these programs, The goal of this program is to help patients by giving them refund if they were unsatisfied with their patient care experience as it relates to customer service. This is also a way for hospitals to identify flaws within their systems and fix it. This program is not designed to be punitive. It's simply a new way for our hospitals to hold themselves accountable. Ideally, with this program, a patient will fill out a patient satisfaction survey at the end of their hospital stay. Then, if they indicate at all that they were unsatisfied with the customer service they received, that could be rude staff, poor communication, or even a delayed meal, then they'd be entitled to a refund, which constitutes a return copay or a forgiven deductible. Like any policy implementation, healthcare or not, there are factors that we need to consider when deciding whether we should implement this program or not. First and foremost, what is the definition of the best patient care experience, and how do we standardize that? Hospitals in urban towns versus rural communities are most likely in significantly different financial realities that could put smaller hospitals at a disadvantage. Does this actually hold our healthcare systems accountable? How would insurers react? Private insurance, the Affordable Care Act. If I were relying on government-assisted health insurance, do I even have a right to a refund? Is it legal? How do we take into account patient conditions, comorbidities, overall health, mental and behavioral? Facilities that are less aesthetically pleasing might be at a disadvantage solely because they can't afford expensive architecture. And last but not least, will past patients be able to do this as well if they didn't have the patient care experience that they were entitled to get? These are some factors we'd like for you to consider as we go along with our presentation today.
So moving on to point number 2, an example of one. Geisinger Health System actually implements the money-back guarantee. It's located in northern Pennsylvania and serves rural communities by being its largest employer. Also has its own insurance company, which really facilitates them being able to conduct this policy. So how do they implement it? They want all of these goals to when they're implementing this policy. They want to satisfy patients and identify flaws within their system, as well as extinguish negative events and increase patient loyalty with them and their families. Their entire compromise is that the benefits outweigh the small percentage of refunds and partial refunds they'll be giving out. So now let's look at how they implement it. They've created their own app. It's called the Proven Experience. It starts out with, are you dissatisfied or satisfied with their service? And then it moves to the most important portion, where it asks you what you're dissatisfied with. Whether it's working with nurses, billing, or learning what to expect about care, it's all customer service related items. So it's not regarding complications or issues with the surgery. It's mainly customer service items. Also, they offer a money-back guarantee up to $2,000 with no questions asked. So let's look at some data. For their first fiscal year, they refunded $322,000. And the second fiscal year, they refunded $411,000. And as of March 2018, they refunded $266,000. That's already more than half of the amount they refunded in 2017. So it's interesting just to see how this upward trend will continue as they keep trying to offer this money-back guarantee. So taking this data and other feedback, they created the CI Care program. It focuses on connecting with compassion and introducing yourself with integrity, as well as using these items just to standardize their care. They use color-coded uniforms, structured conversations that often end with Xing with excellence. Also, they have to ask for permission to do everything with a patient, whether it's touching them or inserting a needle. All of these things have to be very clear. So let's look at some advantages and disadvantages.
So now that we've discussed what a money-back guarantee is, as well as what Geisinger Health System does, we have to look at some of the advantages and disadvantages of offering a money-back guarantee. Keep in mind that one of the main objectives of offering a money-back guarantee is to uphold the integrity of healthcare officials and also to improve patient satisfaction. So that being said, one of the main advantages of offering a money-back guarantee is that it holds healthcare officials accountable because they'll be rated on their performance. We won't have to call into question a healthcare institution that consistently receives negative reviews. Also, it improves branding awareness or publicity. Keep in mind that Geisinger has utilized this opportunity to offer a money-back guarantee as a way to market itself as a hospital with a culture of compassion and dignity. This in turn puts more eyes on the product and gives it more exposure so that we know about what's happening. So now we've discussed some of the advantages, we have to look at some of the disadvantages as well. One of the main disadvantages is that it's extremely difficult to implement at the national level. We have to remember that Geisinger has their own health insurance company, so it makes it a lot easier for them to give money back. Whereas other hospitals, they have patient populations that differ in their health insurance sources. Also, it's an extra expense. Geisinger also has a patient advocacy committee that audits the claims of individuals who want a refund. So in implementing a money-back guarantee, we would have to hire more personnel for the screening process, and that would be an extra expense to the hospital that we would not want to see. And then finally, kind of piggybacking off of the extra expense portion, is there's a high risk of systemic abuse. There are some instances in Geisinger where patients were wanting their money back for trivial matters such as a late lunch, the full $2,000. So as we can see, this is going to start to add up over time and become an unnecessary expense that hospitals should avoid. And so with the advantages and disadvantages being analyzed, this does beg the question:
should healthcare systems offer a money-back guarantee? This program is very difficult to implement, and it may not even be possible for most hospitals based on the factors that Antonio has talked about. In addition to that, Mr. Wright Lassiter, who is the Henry Ford Health System President and CEO in Michigan, has told us that there are many cases in which hospitals already do give money back, especially in cases where there's an egregious error that occurs. Last and most importantly, I'd like to make a point that when a patient exchanges durable goods with a healthcare system, essentially a contractual event has occurred. What has made this financial reality different from all other business entities is that the relationship between a patient and the healthcare system is built on trust, on professional oath that goes far beyond a paper contract. That said, how else can we hold our healthcare systems accountable?
Accountability can be based off of many different things. but a lot of hospitals focus on high recognition and reward to give that higher patient satisfaction. And a lot of those concepts are based off of the motivation equation. It starts out with a higher recognition and reward, leading to higher employee engagement, eventually higher employee satisfaction, and ultimately our goal, higher patient satisfaction. And this is summed up with Gerald Akerdale's quote, "Recognition is the greatest motivator." And this concept is what our policy proposal is based on. It's in 3 phases.
The ultimate goal of our policy proposal is for healthcare systems to create a culture of accountability, and that starts with phase 1, which is development. We encourage healthcare systems to take a look at their past patient satisfaction surveys and figure out what flaws they have within their system. And then from there, they'd set a goal or a benchmark for improvements for their shortcomings and improve those outcomes, which would then lead to phase 2.
So in phase 2, in the enforcement phase, we would utilize a commitment from various departments such as cardiology, pediatrics, behavioral health, and we would have them commit to a goal of patient satisfaction. From there, this will create a trickle-down effect in which our staff will also commit to patient satisfaction. Of course, this would be instituted by analyzing the data. And the departments that perform the best in satisfying patients will be rewarded with a variety of incentives in which my colleague Alex will discuss some of those amazing benefits.
As Antonio said, the 3rd phase is compensation. Those departments with the highest response rates for their customer surveys will be rewarded with paid time off. And this just takes these reward systems that are already in place in hospitals and takes it a step further. We like to enhance the programs that already exist and focus on accountability and customer service. So, before we leave you today, we'd like to impart with you with 2 important quotes that just reiterate our policy proposal. The first quote is by Stephen Covey, which says, "Always treat your employees exactly as you want them to treat your customers." The second quote is by Hal Rosenblatt, "The customer comes second." And what Hal Rosenblatt means by this is that treat your employees the best, and in turn, they will treat your customers the best. So just reiterating our policy proposal, these 2 quotes want us to recognize and reward our employees to encourage them to deliver the best customer service. And in turn, we will reduce the need for a money-back guarantee policy.